I think in the state of California, we've gone through a tremendous evolution in healthcare in a very, very short period of time. Not to say that there weren't things happening earlier, but with the budget surpluses that have existed in the state, we are now on the cusp of getting to true integrated healthcare, to actually having behavioral health be a focus of everything we do, to looking at everything that we perform within the state through the lens of equity and quality improvement, and also to ensure that we are being able to deliver the best and most affordable benefit packages for our commercial clients as well. So whether you look at the Medicaid system, whether you look at the commercial system, there's a lot of integration occurring right now. It's a very exciting time to be in healthcare, but there's also a ton of work and coordination that we must do in order to succeed in the future. And there's different pieces within the organization that are focused on different aspects of this healthcare evolution. So for example, in the Medi-Cal space, we have a tremendous focus right now on building and aligning to the state's population health system. This is a new field of work that has happened in different places, both across the company and across the state agencies, but it's all being brought together. So population health management is going to be a tremendous focus for the Medicaid and Medi-Cal team here in California. I also think that we have other agency work, whether it's BH integration for behavioral health, ensuring that we are doing as much as we can for the children and youth. There's a really big lift going on right now called the Children and Youth Behavioral Health Initiative. And that, again, requires coordination not only amongst the alphabet soup of agencies within the state, everyone has their own jurisdiction, but it also requires health plans to work across the plan, commercial and Medicaid, as well as with counties, to ensure that we are building a healthcare system of the future that can really provide coordinated, integrated healthcare for our youth and children in California.